Hi, everybody. Welcome. My name is Bryan Layton. I'm the Assistant County Manager. We're here with Rhonda and Mauriah, and we're going to talk a little bit about vaccines. If you guys wouldn't mind just introducing yourselves and tell us a little bit about what you do here for the county.
Okay. Go ahead. My name's Rhonda Krouse. I currently work with the Public Health Emergency Preparedness under Emergency Management, and I am the vaccine lead for our Navajo County Emergency Operations Center.
My name is Mauriah Walker. I am a registered nurse, public health nurse for the Navajo County Public Health Department. I work out of the Sholo offices, and with COVID, I've done contact tracing, and currently I am involved with the Emergency Operations Center for Navajo County. I'm the nursing liaison for the EOC for short, and so I just communicate back and forth with the Emergency Operations Center and our nursing department and the local hospitals and health facilities, and I'm the clinical coordinator for the COVID vaccine.
Okay, that is a mouthful. Okay. Well, thank you both. I know you guys are working really, really hard for a really long time, so appreciate you taking the time today to talk with us. So we're going to talk a little bit about vaccines, specifically the COVID vaccine. And I know currently, as of right now, there's two different vaccines available, right? If you would talk to us about those, the differences between them, and which one of those are we using here in Navajo County?
I will answer that question. So there are the two different COVID vaccines. There's Pfizer and there's Moderna. They are both mRNA vaccines, and the M stands for messenger RNA vaccines. And these are both new vaccines that have been developed for the prevention of COVID. They've been studying the messenger RNA vaccines for many years, and they've just figured out a way how to put that messenger RNA in a lipid capsule and have it become a vaccine. The COVID vaccine isn't a live vaccine. You're not going to get COVID from getting the vaccine. That messenger RNA will tell your cells, your DNA, how to make antibodies to fight COVID. And after it does its job, it dissolves right away. And the difference between the two vaccines, like Moderna is what we have in Navajo County. And that right now is the only vaccine that is given in Navajo County is Moderna. We felt like the efficacy from Moderna was really good. The efficacy rate after that second dose of vaccine is 94%, and it doesn't require the freezer, the low temperatures, the transporting it. It was a little easier on us in the county as to getting that countywide that Moderna out to people. So right now, Moderna is the only vaccine that you can get in Navajo County.
Okay. And so in a rural county setting, it just made more sense logistically with the deep freeze versus the other vaccine?
Correct. And when you with Pfizer, it's stored at colder temperatures, and so when Pfizer gets shipped, it has to get shipped to the facility, and it can't be transported or moved anywhere else. So that was going to become a problem for us if we just got the vaccine at one site, and how do you get people vaccinated without? So Moderna is easier. So we're able, the manufacturers are actually shipping Moderna directly to the healthcare facilities who are offering.
Okay, awesome, thank you.
Mm-hmm.
And so here in Navajo County, we began providing that vaccine a couple of weeks ago. And as public health workers, have you received it? I'm curious to your experience. Like, how did it feel? Did it hurt? What did it feel like?
I have received it. I've just received one dose. The side effects that I had from it was a sore arm. My arm was pretty sore that night. Whenever I would move in the night, it would wake me up. I was like, I could feel it whenever I moved my arm. So, but it was nothing that Tylenol or Advil, it helped. It relieved. And the next day, it didn't bother me at all. And talking to people, we haven't seen a whole lot of adverse reactions from the Moderna vaccine in our county. Just some side effects. And side effects and adverse reactions are different. An adverse reaction usually occurs within the first 15 minutes after getting the vaccine, and that would be like an allergic reaction. And it's mandated that after you get your vaccine, you have to stay for 15 minutes and they watch you, because usually if you're going to have an allergic reaction, it would be in those first 15 minutes. So after you get your vaccine, you will be required to wait for 15 minutes before you leave the facility. And side effects could be chills, body aches, headache. The one thing that we are learning, if you've previously had COVID, if you had the disease of COVID and you go get vaccinated, we're seeing that those side effects could maybe affect you a little bit more. But like I said, it wouldn't be anything that Tylenol or Advil, and it shouldn't last longer than 24 to 36 hours for you.
Okay.
So.
Well, hey, it looks like we had a couple of people jump on just a few minutes late, and they're asking who you guys are. Would you mind just real quick just introducing who you are again, just for the benefit of those that just jumped on?
Rhonda Krouse from Navajo County Emergency Preparedness Planner. Excuse me. Work under emergency management and the vaccine lead for our Emergency Operations Center.
Okay.
I'm Mauriah Walker. I am a public health nurse for the Navajo County Public Health Department.
Awesome. Thank you. Appreciate that. So, I'm sure folks have seen this on the news, concerns about the supply of the vaccine. Here in Navajo County, will demand exceed the supply for the vaccine?
Yes, so we're already seeing that. As of right now, we have 14 facilities throughout Navajo County that have onboarded, which is a state recommended program for them to actually provide the COVID-19 vaccine to the citizens. And we're actually running into the short supply right now of the vaccine. And so all of those patients that are actually registering on the patient portal of the MTX platform or the Arizona vaccine system, we call it the MTX platform for short, you're going to see that some things, by the time you get to the end, it's going to say not available or unavailable. So there's a couple of reasons for that. One is because the facilities are not planning events more than the supply of vaccine. So it's going to say that there's not any available because the facilities have not implemented an event because they are running short on the vaccine. Another one is maybe you didn't answer the questions correctly, and also unclick the 50-mile radius on that last page, so that way it kind of broadens your search.
Okay.
One thing I want to add to that, Rhonda, is that we get vaccine weekly from the state. We are allotted a weekly amount of vaccine, and we're asking for 2,000 to 3,000 doses a week from the state, and we're not getting that much at all.
And last week we just got a couple hundred, correct?
We got 400 last week, which the boxes come to boxes of 100, so we can't split that box up. So we have to divide that by, so 4 facilities in our county get 100 doses. So that's tough. That's a hard thing. So we are just at the mercy of the state and some the feds and the manufacturers.
Right, and to elaborate on what Mauriah is saying, some of our facilities were allotted that first dose, but they have not been allotted doses after that because we're in such short supply.
Yeah, but every week we work with the state, right? We're advocating with the state. We're letting them know what our needs are. But the state's in a tough position right now, right? Because there's just not enough to go around.
And we want to be very open and transparent. We want to be honest. And there's a vaccine shortage. There's not very much vaccine right now. And so we expect that shortage to last for the next 3 to 4 weeks.
And just to elaborate on that, when COVID first started, we were kind of in the same situation for the COVID testing. There wasn't enough supply of the testing, and so now we're in another nasty circle of not enough vaccines for the demand that we need.
Okay, and that's probably the reason why we started rolling out, and the state asked us to roll it out in phases, right?
Correct.
Identifying high priority folks moving through. Okay.
Yes. So the state was the one that implemented all of that. It's not us as a county that made those tiers. The state is what mandated those, and we're just the liaison to that.
Okay. So how long is the vaccine actually effective against the virus? Do we know that? Will folks have to get a new shot every year? What do we know at this point?
This is a hard question because COVID is so new and we don't know a lot about it. We're still learning. So there's not a definite answer to that question right now. Something I've read was that the COVID vaccine, there's a possibility it could last 3 years. There's a possibility that we could have to get it yearly like the flu shot. So they're learning and trying to figure that out for us. So we haven't heard a definite answer on that.
Okay. So we just don't know right now. Okay. Well, when folks do get the vaccine, it comes in 2 doses, right? Can you talk to us about how that works?
Sure. So the first dose is obviously we implemented that, I believe, the fourth week of December, and a lot of the healthcare facilities, they vaccinated their own healthcare employees. And so now we're going to wait 28 days. We do have a grace period of that 4 days for that second dose. And so we're getting close to that second dose. It'll most likely be the end of this month, the first week of February is when we'll start looking at that second dose for all of those first dose people.
Okay.
Yeah. So 28 days is the day. That's to remember that. Yeah. 28 days. So.
Okay. And so if I went and got my first dose, how am I notified or reminded to come back for that second dose? How does that work?
So some of the facilities are taking it upon themselves to email each individual patient that came in the first time. They also get a card whenever they do get vaccinated that lets them know the 28 days when to make that appointment. The MTX platform that we talked about earlier, that's supposed to be giving out a reminder email to all of the patients that registered. They'll get an email stating, just a reminder, go back onto the MTX platform, re-register for your second dose.
And that can fall back to personal responsibility too. I mean, you get that card and it's like, it's always in the back of your mind. Like, has it been 28 days?
Yeah.
No, it's only been 10. But
Put it in
you just
Put it in your calendar.
Yeah,
just be aware.
everybody's got a phone.
Yeah.
It says you make a little appointment, ask Siri to help you out. And,
Yeah.
Okay.
And we do try to recommend that you go back to the same place where you got your first vaccine at, but that's not a requirement. You don't have to. But
Well, just to go off that, is you can't get the Moderna vaccine and then get your second vaccine as a Pfizer. It has to be Moderna.
The same. Yeah.
Okay. And we just got another question of, I think just re-asking that question of, well, why isn't Navajo County getting enough vaccine? And I think it's a simple principle of supply and demand. The manufacturers are working 24 hours a day trying to develop more, but there's just way more people that need and want the vaccine than available.
Yeah.
Right.
So that's the reason for the phasing, but the county is working every day to get more, to allocate it in the right places.
And initially, they were doing allotments upon on population, based on population. And I think they're changing that.
Right.
All of this information changes, always. Like, just be aware, anything we say can change.
But they also sent out surveys, probably in October, November. The state sent out surveys that also asked people, would they be willing to get the vaccine? And so that's how the state kind of gathered their numbers, and we're seeing the opposite of that. We're seeing that everybody wants the vaccine now. And that could be because of the new guidelines that are coming out, the new information that's being flooded, and that's okay, but that's where the state's kind of getting their numbers.
Well, and here locally we did a survey of folks, and if I'm remembering correctly, that the demand wasn't as high in that survey, but even just a couple months later, we're seeing that the demand is higher now as people are maybe learning more about it.
Yep. It was about 50%. That our local Navajo County survey was about 50% of the people who answered yes, they would be interested in vaccine. And for 1A, it wasn't that. I don't feel like our demand was that high. I think if you wanted a vaccine in 1A, one was available. And as we've moved into 1B, we're getting busy.
A lot more.
Okay. So here, just a couple of months ago, I took advantage of one of the flu shot clinics where I just kind of drove up to Timber Mesa, and you were there, and I got my flu shot with my kids, and it was real easy. But that's not how this is going to work, right? With the COVID vaccine. Tell us a little bit about kind of why we're not doing drive-up clinics like that, and how's.
So the first phases, the counties were told to be in charge of those first phases. So you have Phase 1A, which was the healthcare. Phase 1B is what we're in now. And we were the ones that were going to be in charge of the vaccine allotments and distribution of those to those onboarding facilities. Those ones that I talked about earlier, was 14 throughout Navajo County. And so we're actually in charge of those vaccines, where they go and how they're distributed. And we don't plan on opening the pods, which is the point of distribution, until Phase 2 and 3, when the general public can get those, which is what you're talking about, the drive-through clinics.
And we will see some pods. They're going to be just like that food clinic. Eventually, when we get
Right.
there, when it opens up into phase 2, we will be doing the pods exactly the same way we did those food clinics, and that's why we do those food clinics that way. Is to practice in case something like this needs to happen. And our local fire departments and our local law enforcement that have helped practice with us for those food
Right.
pods for years, they're going to be there. They're going to be vaccinating. They're going to be helping us. And like we know how to do it. And you will get to stay in your car, sign up online and drive through eventually when we get to phase 2. But for right now, they're not wanting people congregating, not wanting people standing in line. And you can't walk up. You can't walk up to any of the vaccine sites. You have to have an appointment.
Okay. So kind of two questions here, and they're a little complicated. Things got really complicated today because we got a lot of new guidance that's being issued here just this morning, right? Can you tell us a little bit? I know you guys don't know much, but what do
Right.
you know about that new guidance, and what does that mean for us as we move forward the next couple of days? Because a lot of people here are asking about how do I register and how do I get in line basically for the vaccine, but that might look different over the next couple of days. What do you
Right.
know, and what?
So if you turn on your TV or if you read the social media, it's the CDC has put out some kind of guidance asking the states to open up the next phase, which is the 1C phase, which is the 65 and older and adults with, what do you call it, high risk.
Comorbidity, any
So-
comorbidity.
So right now in Navajo County, it's not us, I guess we haven't quite figured out if the state is going to move as a whole to do that, or if the state is going to let us as individual counties move and open that next phase. Because right now we're hurting for supply, and if we just open up another tier, that's just more people that is going to have to wait for that vaccine. So as of right now, like Mauriah said earlier, things change.
Yeah,
hourly.
We're waiting for guidance from the state. We haven't heard any specific
Right.
instructions from the state on this on these new developments that have come out in the media today from the federal government. So,
So
we're just waiting.
I know you guys are in constant communication with the state, like
Right.
multiple times daily,
Yeah.
but they just received this instruction
Right,
too. So
correct.
they're digesting it, seeing how it can work statewide,
Right.
and then you guys will get together and figure, okay, well, how does that translate down to the county
Right.
level, right?
And I think what we talked about before, after getting information that there was a new meeting, was that this week we're going to go. Things are going to stay the same this week.
Right.
We've already got appointments set up. Allotments are out and going out for the different healthcare facilities. So things are going to stay the same this week. So. And we are
changes
working
right now.
very hard on public service announcements and doing things like this and trying to get the word out. So, and our healthcare facilities are working really great with
Yeah.
us, and we really appreciate them. and
They
all
are
of their
definitely
help. Yeah.
overwhelmed.
Yes.
So, speaking as those patients, please be patient with us, and please be patient with your facilities that you're trying to get registered with, because they don't have a choice. We get what the state tells us. We can't make the vaccines. We are at the mercy of the state, and so we try and do our best to facilitate information, communication with our facilities and to our community for that matter. So just keep trying that patient portal.
Right.
Yeah.
Yeah.
And we'll, I'm sure we'll get back together probably here in a couple of days as more guidance comes down. We'll do another video like this to kind of explain what has changed, if anything, and how to move forward.
Our dashboard, our Navajo County dashboard has the latest. We'll always have the latest, most current, up-to-date information, and that's even somewhere where I go, where I need
Right.
to. I just look there. Like everything's on there, and I really think that's a great resource to use to look at. And so that can be found if you just go to our Navajo County, or is it az.gov?
It's NavajoCountyAZ.gov.
Yeah, and then if you go there, there's a link to get you onto that dashboard.
Yes.
The registration links on there and stuff, and like I say, who knows if that link will be gone, and we don't know.
But that's where we will keep the most current
Correct.
up to date
Yeah.
information. Okay.
Right.
There was a good question that came through that said, if we're short on vaccines. We don't have enough that we need. How can we assure that folks who got the first dose, that there's vaccine for that second dose?
So before they distributed us our allotment, they set aside that exact same allotment in a warehouse somewhere. So our first allotment was 2,800. So they set that allotment aside for that second dose people. So that second dose allotment is actually in the mail as we speak, and those facilities should be getting it this week. So those second dose people don't need to worry about it. Just make sure that you go to the same facility if possible to get that second dose.
Okay, so that was already pre-planned.
Yes,
They don't
pre-planned.
need to worry about that.
And all this information could change. And as we switch from one administration to another in our country, you know, things might change, and we've heard that things might look a little bit different. Maybe, you know, pushing out all the vaccine and not holding back any or second doses.
Yeah.
So we'll see.
Yeah.
We will keep you updated.
Okay.
So we just have to be patient.
Well, I really appreciate your time, and I just want to point out, like, how positive you guys are. I know the hours that you all have been working since March.
Yeah.
And it's really fun to see your smiling, your positivity. Mm-hmm. And it's sometimes you just work as hard as you can, right? And all you can do is smile and laugh a little bit and just get back to work, right?
Yep.
Yeah.
So
Definitely.
thank you both
definitely
very
have
much.
our challenges, but at the end of the day, you just, like you said, you gotta smile because otherwise you're gonna cry.
Well, you guys have a great team. Thank you very much for your time, and we'll probably talk here in a couple of days.
Sounds
All
great.
right.
All right.
Thanks.